Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we're taking your calls at 866-870-5752 right here in the studio. And when you phone the program today, you get Dr. Darrow's latest book for free called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It has 264 scientific studies.
You know what else it has, Nita? I'm laughing.
Yes?
I'm going through the book, and I have 5 children. And there's pictures of all of them doing their sports in here. From
That's
surfing, dancing, soccer, running, and biking. And I'm very lucky to have a household full of sports people. And, you know, to be honest with you, the time that I spent with my kids when they were young was all for me. It was all sports.
You trained them well.
I have twin daughters, and they're what's called mirror twins. One's a lefty and one's a righty. And I taught the lefty, Jordan, they're twin sisters. Jordan, I taught everything right-handed, so she's bilateral. What do they call it? Ambidextrous.
Right. Oh,
which is great because she was the captain of her soccer team, D1 soccer in college. And she's bilaterally or ambidextrous footed, which is really important in soccer. Anyway, we're going to go to Bernadine. Bernadine, Dr. Marc Darrow, how are you? Thank you for calling in. What's up with your uncle? Cat got your tongue?
No, it's Bernadine, are you with us?
Hello?
There you go. Yell at us so we can hear you, Bernadine. It's Dr. Marc Darrow. How are you?
Oh, I'm not too bad. But I wanted to know, do you see patients? I have a dear uncle that's 93.
Yes.
And I wondered, can you do him? I mean, is that too old? Because he won't go to surgery. He refuses to do that.
Sure.
So
well, let me tell you a quick story.
I wondered if maybe he could come and see you.
Yes. We'll talk about more what it is that he's got, but I just want to tell you these stories. I had a man come in who was 100 years old. He was about 6'4", very strong and athletic looking, and I did both of his knees. And as he got up off the table, I said, should I go out to the waiting room to get your driver? And he stood up off the table, and he was glaring down at me, because I was only 6 feet, and he was 6'4". And he said, Mark, do you think I can't drive? He said, it was my birthday last week, and I just bought myself a brand new Mercedes.
Wow.
So, yeah, I get a lot of people. I had a 91-year-old yesterday who you would think was 60, more power than a 60-year-old. So age doesn't really matter these days. There's something in the water. And kids are getting a lot taller. All my nieces and nephews are giants. Most of the guys are about 6'3", 6'4". I have a grandson who's 6'5". So there's something going on. I don't know what it is. People have ideas that we're eating better or that there's steroids in the food. Who knows what it is? But age doesn't really have much to do with this. And I have a lot of patients who are young who act old, right? So the number... The chronological age means nothing. I mean, I laugh with my patients all the time, and they say, you cannot be 74 years old. And I go, well, the body might be, but I certainly am still 16. And you know what I mean? It's attitude. And I got a lot of attitude. You ask anybody. Right, Nina? I got plenty of attitude.
Well, they live, out near Menifee. I mean, they're a long ways from here. But I wondered if you were able to check him out because he refuses to go to he won't go to a regular doctor. He doesn't do that.
Well,
So
we didn't talk yet about what it is that you think is bothering him.
Well, his main thing is.
I can't hear you. Talk a little louder. It's a little muffled.
Okay, I'm sorry. He's having trouble walking.
Okay.
And because his age and stuff, but he's used to running and doing things, and now he's gotten to the point at 93 that he can't do that, and so it's really bugging him. He wants to be able
Sure.
to be active, and so
Okay.
I thought, well, I told him I was going to call, find out if he could come to you, and so that's why I wanted to call and find out if he would take somebody that's 93.
Sure. Yeah, there's no problem with that. I'd have to do an exam to find out which part of his body is bothering him. Sometimes people can't walk because of their back. Sometimes it's spinal stenosis. Sometimes it's, knee arthritis, hip, foot, ankle. So I'd have to do a good examination and find out what it is. But
Right.
yeah, the chances are I can help. I can't promise anything, but it's sure worth the
Good.
trip.
I just wanted to know, I thought maybe you would say no because of his age. But
No.
he's been used to being active, and now, he's gotten to the point where he can fall easier, and so he can't be active like that. And
Right.
it really bugs him because he's used to being active. And
You know,
he's
another
not
thing that you
overweight
might
or
want to
anything.
consider for him, there's studies that show that taking testosterone supplementation can really increase the strength and muscle and get rid of frailty and falls. So that's something to consider. If he does come in, I'll talk to him about that.
Okay. Oh, my, thank you so much. He'll be
Yeah.
so glad.
Yeah,
you. I appreciate
thank you,
you.
Bernadine. I appreciate your call. Also, I want to say something I think is kind of funny. I have some patients. My average patient drives about 2 hours to see me. I mean, I get people locally from all over too. But people come from all over. I get people from other states all the time, other countries all the time. And then I hear someone like you who says, well, he lives kind of far away. But that's not a big deal. I mean,
Well, his
it's worth
daughter
it.
would drive him.
Yeah, exactly.
I just wanted to be sure that you would even bother. I thought maybe somebody at 93
No.
would say, forget it. I'm not
No,
gonna
as a
bother
matter of
you."
fact, I was talking about the 91-year-old that was just in. I did bone marrow stem cells on him and his girlfriend. He has a new girlfriend. He's 91. Nothing's going to shut him down. And
Well, I
he had
just
no
wanted to be
problem with
sure
the
because I
procedure.
didn't want to waste their time and your time if
No.
you wouldn't bother with somebody that age. But
well, you can't waste my time because I don't believe in time.
pardon?
Nita, you're supposed to laugh. That's why we pay you the big bucks for your laugh.
That's funny. But I think maybe Bernadine got confused by that.
Well, I'm a little bit of a quantum physicist, so time
So,
doesn't exist
yeah.
in my world. At any rate, God bless you, Bernadine.
Thank
I
you
thank you
so
so
much for
much.
your call, Bernadine.
And God bless your uncle. And it's kind of fun because I'm an uncle of about 50 different kids. We have a we have probably one of the biggest families in the world. And and my
Well,
family
thank you so much
Sure.
for taking the call and talking to me.
Right.
And
I appreciate
I just
your
wanted
call.
to be sure that he could,
Yeah.
that I'll tell him that I'll give you his number and let you talk to him. Yeah, I mean, I'll, have him call you.
All right, that's
And that
cool.
way and that way he can hear you
All
tell
right.
him for yourself.
All right.
that
Thank you so
will
much,
take
Bernadine. I
somebody that
appreciate it.
age. I just didn't want to waste your time if you would.
Yeah.
So,
All right. Well,
Thanks,
we're going to move
Bernadine.
on to Christine in San Fernando. And Christine, this is Dr. Marc Darrow, and we're here to use or teach people about regenerative medicine, which I've been doing for 25 years, which is regenerating tissue in the body rather than cutting it out with a knife. So I was trained in orthopedic surgery.
Now?
I am talking to you. Can you hear me?
Okay, I was listening to the other call with Bernice, and when
Okay.
it stopped and you started talking, your voice went real low,
Okay.
and I
Well,
couldn't hear you exactly.
I can't hear you too good either. So let's both yell at each other and have a good time.
Pardon me?
Can you put your phone closer to your mouth so we can
My
hear
mouth
you?
isn't the problem; it's the hearing.
Ah, I gotcha. Alrighty.
I could,
Well,
I
I'll
could
yell.
hardly
So
hear you.
I'll yell. At any rate, what the call screener wrote down is that you have pain all over your body. So let's start
Yes,
with
and
the
it's
let's start with the
aggravated
place
the
that
last
hurts the
20
most.
years.
What hurts the
started
most,
with-
Christine?
Well, it shifts around all the time. I mean, as soon as I'm walking, it could be my knee, it could be my back, it could be my neck. I mean, this thing has started almost 20 years ago when I broke my disc and herniated it, and now it's got disintegrating disc. But years afterwards, I would go to the doctor, and I said, my side's hurting a lot, and my leg, and he said, it's arthritis. I said, arthritis? Now I have arthritis? And he said, well, yes, because of the broken things, it spreads. The arthritis spreads. He said, I had arthritis in my back, too. So I told him, I said, great. Now, I don't know what to do. I mean, they wanted me to have surgery several times, and I told them no.
Good, you're smart.
Every time I talked to somebody that had back surgery, it was repeated 2 and 3 times, sometimes 4 times. I said, no, I'm not going to be operated on that many times. If you can't fix the back on somebody, and I mean, this is several people.
Okay.
So I decided I wasn't going to be one of the party to that surgery.
Okay. And I'm another person that was not going to be a party to it. I had terrible back pain and leg pain years and years ago when I was in my residency at UCLA. And I would limp. I would hold the wall and limp to see my patients in the hospital. I was in so much pain. And all my doctor buddies said, you need to have a back surgery. And I refused. And I did regenerative medicine on my back, and the pain went away, and I'm fine now. I don't know if you were listening to the beginning of the show, but I'm getting ready right after the show.
I've heard your show before, and I've heard so many shows.
Okay. Well, listen, Christine, what we're going to do is talk about your issues a little bit here, because I've had a lot of those issues, and I have self-injected most of them. If it's in somewhere like my neck, I'm not going to inject myself because that's a very area. It's an area that we have to be really careful about. But I've healed every area I've injected on my body, both my knees, both my shoulders, both my elbows, my wrist, my neck, and my back. And I'm trying to think back. I haven't had to inject myself now for maybe 6 months or a year. So I'm doing pretty good. I'm going to go play golf. I ran yesterday in the mountains, and I have been getting by pretty good. So what I'll need to know from you is if and when you can come in the office so I can examine you, all right? We need to do an examination. I don't really care what your other doctors say, because most traditional doctors, I'm going to put it like this, don't kill the messenger, that's me, don't know how to do the healing. They're into surgery and medication, and that's not what I'm into. I don't want to do that, okay? So...
I think we lost her.
Yeah, and I think she doesn't hear very well, unfortunately, so we're better off just talking to her off of the radio. So you can keep listening, Christine. And then, Christine, if you want to call the office, just call 800-300-9300, okay? 800-300-9300, and they'll give you information how to come in, how we do our procedures here. And again, I'm going to have to say this. Nothing you tell me will let me know if I can help you or not. I need to touch your body. I don't care what other doctors say or have told you, and I don't care what your x-rays or MRIs say. I need to use my hands, just like my grandfather did, who was a doctor, before the days of MRIs. He was born in the 1800s, and I used to study with him, okay? I used to go to his office, and I used to hang out with him. And my mom always wanted me to be a doctor, so I used to have to hang out with my grandfather. So I learned a lot from him about natural medicine. And to be honest, I didn't like it when I was a kid. I wanted to be out. I lived in Chicago, and I wanted to be out playing baseball, because baseball is the Chicago sport. But I did hang with him quite a bit, and I learned quite a bit about natural medicine. He was way against having surgery because he saw the bad effects of it. And I also am one of those that's way against having surgery, unless it's an emergency. If you have, a terrible fracture or something like that, get to the surgeon. But for most of these things that are being done today, like meniscal tear repairs, where they're cutting tissue out, rotator cuff tears, I am not for surgery on that. Shoulder replacements, knee replacements, I am not for having surgery for that. I am sorry. The doctors get mad at me, but, to be honest, when people come in with those kind of things and they say they've been to different surgeons and they have to get a surgery, I show them that they don't have to. And most of them we can heal up. Not everybody. I'm not going to be able to heal everybody. It doesn't work like that. Nothing works for everybody. And the success rate with regenerative medicine using platelets and stem cells is very, very high when the right patient is chosen. And I think if the right patient were chosen for surgery, the success of surgery would be very high. It's just that way too many people are getting surgeries that shouldn't have surgeries. And again, I'm sorry I have to say that, but that is my truth, and I'm allowed to say my truth. So we got a caller getting ready to come on here, and in the meantime, I'm going to go to a question here.
Okay.
This one says, let's see. Oh, this one says, horrible chronic pain. Let me see what this person says. Well, this sounds a lot like Christine. Need help with horrible chronic pain going on now for 18 years. Doesn't really specify, what part of the body or what the issue is. But I deal with this all the time. I get a lot of people with chronic pain. Chronic is simple. It just means more than typically around 3 months. Acute means new pain, usually under, 3 months or so. And we can treat acute pain or chronic pain, doesn't matter. We inject with platelets and stem cells from your body and help heal things up by growing back tissue. Now, there are some pain syndromes, things that people have that can be autoimmune or something like that. And what I do may not help them. We may have to get into things like diet. Doing an alkaline diet often can help. And I've had stuff like that on my body too, where I've had to change my diet and get off of inflammatory foods. That's a whole different issue though. And sometimes people with pain all over can be helped with regenerative medicine, and sometimes they cannot. So that's something, again, I have to examine the person. I cannot tell you over the radio whether I can help you or not. I'm going to go to another question here. Bulging disc L4, L5. Let's see what this person has to say. Hello, is there any help for a bulging disc at L4, 5 that these procedures of regenerative medicine with platelets and stem cells can help me with? Good question. Again, I have to touch your low back where those discs are. Most of the time, bulging discs do not cause pain. Don't kill the messenger, surgeons. I get people that come on all the time. They go to a surgeon. The surgeon says, I've got a bulging disc. I need surgery. Well, in my experience, bulging discs don't cause pain. Most people, as they age, get bulging discs and don't have pain. Now, if you've got a giant herniated disc or an extruded disc that's sitting on a nerve and your leg is dead, that's a case that I may send you to a surgeon, but not first. I would send you to somebody, first of all, I might be able to help it by injecting platelets and stem cells in the low back, or if you have neck problems and you have arm radiculopathy, I might be able to help. But there are other types of practitioners that sometimes can help that also without having a surgery. Okay? Anything for you to say, Nita?
Well, yeah, I just don't like to hear that people have been sitting in chronic pain for many, many years without feeling like they have any options. So I'm really glad we're here to provide.
And we have a couple of minutes left, so if you want to call me right now,
yeah.
Phone number 866-8 870-5752. I'd love to talk to you. And the office number is 800-300-9300. I'm going to take another question here that says subtalar joint surgery. Let's see what that's about. Hello, my mom listens to you on the radio and insists I contact you before moving forward with subtalar joint surgery. That's a smart mom. Oh, and they say, and I always listen to Mom. I injured my ankle 20 years ago at age 21, and it has been very slowly become more of an issue. In the last year or two, it has become significantly more painful and is affecting my everyday life, as well as causing issues in my other foot from limping and overcompensating. I've seen an orthopedic surgeon and have a podiatric foot and ankle specialist over the past few years. We've tried braces and injections, but both are saying that I need subtalar joint fusion. Well, I'm going to probably disagree with that one right off the bat. Wondering if the subtalar joint issue is something you have had success treating? The answer is yes. And if so, what would be the procedure to discuss further with you? Thanks so much. I would inject it with, your platelets and maybe stem cells, depending on what I find, if that really is the issue. And I say if it's the issue, I'm saying that because just because other doctors say that's the issue, it may not be. When people have surgery and come to me afterwards because it failed, and I touch the body and I find out where the pain is from, and I say that's not even the area that was operated on. What happened? Did the doctor ever touch the area? And they go, no. They slapped up an X-ray or an MRI on the light box and showed me where the problem was and then did the operation. Well, that wasn't the cause, so be careful not to get a surgery because your doctor says they found it in an imaging, in an MRI or an X-ray. Those are red herrings. That means it's something that looks like it's a problem but may not be a problem. So we have to be super careful not to do a surgery on something that is not the problem. So I'm going to go to Angela. God bless you for calling, Angela. We love our callers. The question is, have you heard of stem cell activators? The answer is yes, I have.
Oh, good.
The answer to the real question is, do stem cell activators, are they needed and do they work?
Yeah.
In my experience, the answer is no. But that's my experience.
Okay.
If you do it and it makes you feel better, then you hit 100% and you should do it. Anything that works, as long as you're not hurting somebody and hurting yourself, I think you should do it. Mm-hmm. So have you tried stem cell activators in the form of a supplement or red light therapy or something like that?
Hello?
Yeah.
Oh.
Have you?
There's different types of. It looks like, I've seen this person on TV, and they look like they have different types of stem cell activators for different parts of the body, like for the CNS and then for the joints and knees and stuff like that.
I'm not against it. It's just I don't think going to be very powerful.
Yeah,
in my experience.
They said it could take as long as 3 months.
Well, again, I'm going to say the same words. I don't think it's very powerful.
Okay.
I'm not going to say it doesn't help.
Right.
But it certainly is not the same as injecting stem cells into the body for musculoskeletal problems.
But what does it do? Does it activate your brain or something? Or
Are you talking about
the stem
red
cell
light therapy?
Do they activate
Well, you
your
have to
brain?
be specific. Tell me what you mean. Activator.
I'm wondering if the stem...
Here, listen, I'm going to give you a hint on something that'll help us both. Go to www.lastemcells.com and ask me a question. There's a spot to email me on every page, and I'll get back to you, and we'll get a dialogue going, and I'll get you more specific information because we're in the end of the show. God bless you all. The studio number we gave out, the office number is 800-300-9300. Thank you, Nita Valens. Thank you, Suzette and Alex.
Bye.
God bless you all. Thank you.
You've been listening to Living Pain Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard Saturdays at 10 a.m. and 1 p.m. and Sundays at 5 p.m. right here at AM 870 The Answer. Remember, to take the first step toward a pain-free life, call to schedule an appointment at 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.